My name is Dr. Kelly Brooke. I'm an orthodontist here in South Calgary. I've been an orthodontist for about 20 years now. I practiced in Fort McMurray for 12 years as an orthodontist, and thereafter I've been here. I'm the owner of and clinician at Brooke Orthodontics. I've been I got into orthodontics quite a number of years ago for the reason that I was an engineer prior to becoming a dentist. So I guess the culmination of engineering and dentistry worked together that led me to orthodontics. One of the great things about being an orthodontist, you have a pretty good chance to make a significant change in people's lives by changing their smile, their bite, and it's just a wonderful job. As I always say to everybody, it's a great gig to be in. A number of years ago when I purchased this practice, it was quite antiquated, and my vision going forward was to bring it up to par because Calgary is a very competitive market. In order to do that, you have to distinguish yourself or set yourself aside that other individuals who are already well established. You have to set yourself aside to produce something and give the client something that they don't already have. So this is one reason why we started to get into the technology, all the latest technology with the computers, the imaging, the software systems, as well as the chair side stuff like AVO system from Smalsonica. Regarding my treatment philosophy, that's sarcastically I always say, treat well and be nice to everybody. But what I try to aim for is to have expediency in my services and to get a good functional, occlusal, and cosmetic result. One of the reasons why I chose the AVO system for my practice were two reasons. Again, expediency of results, but also that protection against root resorption. I have found through my travels and my experience that certain ethnic populations that are more susceptible, as also individuals that have had trauma to their teeth and dentition. So those individuals are more susceptible to that mishap of having root resorption. So the analogy I give to patients to protect against root resorption is like playing hockey without a helmet. You have to protect yourself against that phenomenon, and AVO is the system that does that for us. Regarding the expediency of how the AVO helps us in our workflow is that we can change our aligners out sooner than not. But our traditional textbook or cookbook way to change aligners was every 7 days or 10 days. Now with AVO, we're changing them out no greater than 4 or 5 days. As far as our workflow with our bracket patients, we're changing our arch wires even faster now, so that we're reducing overall treatment time, and the patients really like that. Regarding workflow with fixed bracket cases, we find that we're changing our wires out more faster than traditionally. Traditionally, we would change our wires every 8 weeks. With our AVO patients with brackets, we're changing out every 6 or 4 weeks now, again getting the same results. We find the big thing I found that the braces and the system, they seem to work very well together, that there's not an interference with the system as it goes into the mouth hitting the braces. Patients don't have any complaints in that regard. It's quite good. Regarding patient experience and patient feedback, it's been nothing but positive. Patients like the device itself. It's very easy to use. It's ergonomic. It doesn't take a lot of their time. Using the app is very simple. It's just almost seamless as a part of their treatment. They also like the customer service that's available. Well, one of the advantages we have by using the system is it reduces patient treatment times and it reduces the number of visits. These days, people are very busy with families, with work, careers, what have you, and this seems to work well for all of those situations. Regarding the integration of AVO, some of the benefits we've seen is increased workflow, getting more patients in the door and out the door. Again, distinguishes ourselves from other offices in town because it's a very competitive market. One thing as well is that our staff really like it. Again, it's a really seamless integration with the software platform that's used, how to explain it and deliver the service to the patients. It's really a great. Regarding business workflows and profitability, I think AVO is something that increases that for you. By getting people in and out faster, finished treatment, you can then fill your dental chairs and new customers paying new fees. And so that's again one of the definite hidden advantages by using the AVO system. And my experience with Smalsonica has been seamless. It's been absolutely wonderful. From the minute the salesperson stepped into the door, to customer service, to implementation, integration into the practice, and then to delivery to the service chair side with patients. Again, I can't say anything less than awesome or excellent regarding that. So regarding the AVO system, if I were another orthodontist, another clinician unfamiliar with this, I would be tempted, as I say, give it a try. There's lots of accelerated orthodontics out there, but one of the reasons why I chose Smalsonica is because it has the evidence-based research to back it up. A lot of the other guys is empirical. So if you're a new orthodontist just trying to start and distinguish yourself, I would say give it a try. I don't think you'll be disappointed. What sets us apart at Brooke Orthodontics is that we provide a good service and we have lots of fun doing it, but sometimes we can really meet patients' needs. And so I'll give you an example. A while back, we had a small Sonica patient, or an EVO patient, that was on a hot seat to get her treatment finished in a timely manner. She was a scuba diving instructor and had to hightail it out of Calgary to get down to the Caribbean for a very important position as a master scuba diver. And we managed to pull it off with EVO. I think without the system, there is no way we would have done it in that same time period. We got her in and out of treatment within about 4 to 5 months, which traditionally would have been possibly a year's treatment.